in just a few minutes. I just want to make sure I could get on here and test out my audio, make sure you guys can hear me and see me. For those of you that this is your first time joining us, welcome. If somebody could do me a favor, anybody, just in the chat box, which should be in the bottom left or bottom right, make sure, just test in there. You can type in there and say, you hear me, yes, or you can't hear me. I guess if you can't hear me, you want to be typing anything, right? Okay, so we do have a couple people that hear me. Awesome. Thank you very much. I appreciate you guys letting me know. All right, so it is 11:58, so we'll get started here in 2 minutes. Thank you guys for hanging in there. While we are waiting for everybody to come into the room, why don't you guys share with me where you're from? All right, so we have some folks, Marana, Tucson, Scottsdale, Bullhead, Scottsdale, awesome. U of A in Phoenix, awesome. Welcome, Elizabeth. I know U of A has a much larger presence here in Phoenix now than they have in the past, so cool. Oh, Lakeside, awesome. And who do you all represent? Are you students? Are you parents? Do you work in prevention? Are you educators? What brings everybody here today? I'm just kind of curious. Oh, hey, Sherry with Raising Arizona Kids. Thanks for stopping by. Raising Arizona Kids is a fantastic magazine. For those of you that haven't checked it out, I encourage you to do so. We have been featured in there. Some of our staff had articles in the magazine as well, so I really encourage you guys to check them out as well. Okay, so we have some students, parents, people that are part of different partnerships, it looks like. Interns, great. It seems like we have a really diverse group of people here in the room today. We're going to go ahead and get started. It is 12 o'clock. People can still log in if they want to log in, so I'm not going to lock the room. Welcome again. Again, welcome to DrugFreeAZKids.org lunchtime webinar. DrugFreeAZKids.org is now a program of Southwest Behavioral and Health Services. This is something we just announced a few weeks ago, and we're really happy to be part of the Southwest Behavioral and Health Services team and look forward to what this is going to bring to DrugFreeAZKids.org and to Southwest Behavioral and Health Services in the future. This lunchtime webinar is just one of the many services we offer here at Drug Free Easy Kids. We offer webinars, one-time presentations, workshops in our Active Parenting Workshop series, which is 6 weeks long and covers topics from cooperation to communication, building self-esteem, and raising drug-free kids. It's a fantastic workshop series. If that's something you think would benefit you or people you work with, I encourage you after the webinar to check out our website and find out where we're going to be for those locations. Or if you are interested in maybe bringing the program out to your school or maybe a one-time presentation for parents, I also encourage you, check out our website, find out more about those programs, and shoot us an email because we're happy to bring our services out to as many schools that we possibly can, especially here in the Maricopa County area. That's where most of our focus is right now. But when we're able to, we do get out of the county as well. So today's webinar, where do kids get drugs? This is a question a lot of people ask, and because they're like, where do kids get drugs? I know some adults say, I have no idea where to get drugs even if I tried, which is not necessarily a bad thing. Knowing where the closest drug dealer isn't necessarily the best info to have. However, that's not where kids are always going to be getting it from. People aren't going in the back alley with some guy in a cloak that's handing them their pot or their cigarettes or heroin or whatever the case may be and exchanging cash in a dark alley. That's not typically how it looks for kids or for adults. That a lot of us do know. So where are kids getting drugs? That's something we're going to talk about here today. At any point during the webinar, if you have questions, please ask those down in the chat box. Some of you already entered info in there, so I know you guys can see it and it's there. Please feel free, ask questions. If I don't get to it right away, I will periodically and at the end go back to the chat box to see what we have in there, and if there's any questions and things that I can address as well. Before we get started, a little bit about me. I am a program manager here at DrugFreeAZKids.org. I've been with the organization a little over a year. Prior to that, I was living in California and working with the Boys and Girls Clubs as a branch director over there. I've also worked with Students Against Destructive Decisions. I've worked with ONDCP, the Office of National Drug Control Policy, and on a number of different prevention programs, all focusing on helping young people become responsible, productive citizens and avoid risky behaviors like drugs and alcohol. Prevention is a passion of mine, and I enjoy being able to share that passion with you guys today and throughout the work that I do. So thank you guys so much for joining me, and I'm looking forward to the journey that we go on here today and in the future. I know I saw a lot of first-time people in the chat box a little bit ago, which I think is fantastic. These webinars are once a month. About once a month. There's 2 months during the year that we don't hold them. And if you attended this webinar, then you will be getting info about the upcoming webinars as well. I typically send that out about a week, anywhere from a week to 3 weeks in advance, just depending on when it falls. All right, so here's what we're going to tackle today. Where do kids get drugs? Obviously, that's the title of the webinar, and that's really what we're going to get into. But in order to talk about where kids get drugs, I think we really need to address where do kids get their perceptions of drugs. So where do they get these different ideas, knowledge, information or lack of information about different substances? I think is just as important as where kids get drugs, because that can provide us more information in helping raise drug-free kids. And then finally, what can we do? With all this info, what are we going to be able to do? Today's webinar will end about 12:30, but we will also have time for questions at the end. So because 30 minutes isn't quite enough time to cram everything in and get questions, but at the end of the 30 minutes, I know a lot of people are on short lunch breaks and aren't able to stay on. So that's why we try to get everything in 30 minutes, and then we'll open it up to questions and answer it for as long as you guys have questions. So let's start off with, where do kids get their perception of drugs? Well, it comes down to a couple different types of perception. There's perception of risk, and there's perception of approval or social approval. So pretty much that means risk. How risky is this? Is it going to hurt me physically? Is it going to hurt my career, my career goals, school? How risky is it? All around. And then social approval, that's how does society how do I perceive society's acceptance of this drug? And that could be the society as a whole. That could be my family, my friends, my school, a number of different communities that social approval really encompasses. But really, what do I think everybody else is going to think of me if I use this substance? So that's what I'm talking about when I talk about risk and approval. And these are just a couple little icons that I'm going to use to give a little visualization here in just a second too. And I use a thumbs up and that like button, because that's really what it is. The more likes we see on a Facebook post, that's the more that society is saying, hey, we accept this, we acknowledge it for what it is. So that's what we'll use. And then the bomb, obviously, for risk. And there's different levels of risk. Obviously, there is going to be, there's good risks and bad risks that we can take. For today's purposes, I'm talking more about risk of doing harm, either physically, mentally, emotionally, socially, or in one way or another, but more harm. All right, so perception. Kids get perception. We get our perception of pretty much everything in the world, especially drugs and alcohol, though, from a number of sources that I put down here. It could be from family, friends, government, through different policies that the government enacts, local government, state government, federal government, which can be confusing to kids, especially when federal law differs from state law or local law. That can be confusing with the perception of risk. Also on TV, it's not always going to be a negative risk or harmful things that we're going to see coming from TVs. Sometimes it's going to be things like the Truth Campaign, which was played a really big part in helping to curb smoking and underage smoking and even adult smoking as well. A number of positive campaigns that have been seen on TV, but then there's also the things that we see on sitcoms or even in dramatic TV shows or movies on Netflix, whatever it may be, that portray drugs in a more positive light or show them to be less harmful, less risky, or more socially accepted. In the music we listen to, definitely. I had a webinar several months back on pop culture and drugs and how that impacts youth, and a big part of that is music. That's recorded on our website. If you want to check that out, you can do so. And some of you are probably looking and saying, does that say Chuck Norris? Yes, it is. That is Stamp of Approval by Chuck Norris. And what this is really representing is the way that young people, or even adults for that matter, can idolize people in the spotlight, whether or not that person is trying to portray a certain image or not. And that's the case with Chuck Norris. For those of you that are aware, he became this huge kind of icon. And things like what would Chuck Norris do, and a ton of different T-shirts and memes and things that are out there. And he became an icon for certain people, whether he wanted to be or not. And with young people, they can idolize people for different reasons, one way or another. Maybe Rihanna sings a song that talks about drugs and she means it one way, but it's taken another way. So it's not always just what the artist or celebrity or person in the spotlight is intending to share. There's something else that happens sometimes. So I don't want to demonize certain artists, but sometimes what they're trying to get across isn't always what they're getting across, or sometimes they just ignore it as well. And then also on what they see on their smartphone. So on Facebook, Twitter, Snapchat, and every other social media platform out there, there's tons of content that is right at kids' fingertips that are helping form these perceptions of risk and social approval of different substances. There's also going to be experiences that a young person will have. Maybe they try a drug that they perceive to be risky, and for some reason, they say, you know what, I'm going to try it anyway because the pressure is too great from friends, so I just want to see it, and nothing bad happens maybe that one time. Or maybe I know a friend and nothing bad happened. So now their experiences of what happened, even though it may not be completely accurate, or we know maybe just trying certain drugs one time may not be as scary as some of the scare tactics were early on in the prevention game. And now that's altering the perception of risk for all substances, because it's saying, well, hey, this drug or this substance wasn't as scary as the others, or as it was supposed to be, so others aren't going to be as well. Or, well, a drug dealer or a bad person is somebody in a dark cloak. We saw that as an issue with Stranger Danger. Kids were on the lookout for that man in the dark coat. You couldn't see his face, but the reality is that people that can do harm to you and are not great people are going to look just like your friends or your family a lot of times. So their experiences can alter their perception as well. And then their friends, definitely. Friends are a huge part of perception of risk and social approval, as well as what they see at school. This could be messages from teachers, the nurses, pretty much any educator or anybody in education can help you to perceive substances in one way, or you to perceive following rules and making smart, healthy decisions in one way or another. So perception of risk and social approval isn't just in a specific substance, but also in the way young people look at following the rules and what it means to be part of a larger society. So this is just a little a visual that I think that it helps me, and maybe it will help some of you guys better show how perception of risk and perception of social approval go hand in hand with kids deciding whether or not a drug is worth trying or they should just completely stay away from it. So as you see with the like button, the thumbs up, that's our social approval. So as social approval gets greater and the risk is less, kids are going to be more likely to experiment or try a certain drug or use it on a regular basis because they perceive it to be less risky and they perceive it to be more socially accepted. Whether or not that's the case with risk and social approval is another thing. We're talking about perception because how kids perceive things is just as important as how they really are. So, and then as you can see, as social approval decreases and risk increases, the perception of those, kids will be less likely to engage in risky behavior, things not just drugs and alcohol, but any type of risky behavior in general. And this definitely applies to kids, but it also applies to us as adults and human beings. This is how we make a lot of the decisions we make is based on, is this going to do harm to me, and is this socially accepted? So where do kids get drugs? Well, over 2/3 of Arizona youth will use alcohol, tobacco, or other drugs before they graduate high school. So a decent number of kids, fact, that's what kids are telling us. I'm going to use the Arizona Youth Survey today for a lot of the data that I'm going to present and share with you. The Arizona Youth Survey is a fantastic survey that's conducted every 2 years. The last one was conducted in 2014, which we got the results towards the end of 2014. This year we will be, I don't say we use it every 2 years when it comes out, but it's actually conducted by the Arizona Criminal Justice Commission. And actually have it right here. I know not everybody's going to have it printed out, but it's something that I print out and I keep at hand. If you're a prevention professional, I highly advise you keep it on hand or at least bookmark it in your favorites on your computer because it's very valuable information to have. And the youth survey tells us a little bit about what kids, actually a lot about what kids are using, different behaviors that they're engaging in, where they're getting certain substances from, and a number of other topics. Today, I'm going to focus on the sections that share, that let us know where kids are getting different types of drugs at different grade levels. Alcohol. Alcohol is the number one substance abused by kids here in Arizona, across the country, hands down. Number one drug of choice for teens in Arizona. Underage drinking today, what does it look like? Well, a lot of it's in the form of binge drinking. It's not kids sitting down watching their favorite show on TV and having a sip of wine and laughing and having good conversation. A lot of it is binge drinking, which is drinking as quick as you can, as much as you can, to get as drunk as you can. That's the point. There is no other point than to get as drunk as you can. There are some underlying factors there, why, as far as to be accepted and things like that. But the whole point of binge drinking is to get as drunk as you can, as quick as you can, essentially. Even people that kids that don't binge drink and drink as much as would be considered binge drinking, a lot of times will pretend, I guess you could say, that they are that wasted because that's something that's in their circle is socially accepted and makes you look cooler. And then mixing alcohol with medications and energy drinks is another scary part of underage drinking today. We know when alcohol is mixed with any kind of medication, whether it's prescription or over the counter, can have some really harmful effects. And even mixing it with energy drinks, you have something that pretty much you have one substance that is telling your body to speed up and one that is telling your body to slow down. One is suppressing your central nervous system while the other is trying to get you to go full speed ahead. So that can be that's very harmful for the heart and the body as a whole. And something also pretty sad, 15% of teen drinkers say that it's a habit and they can't stop. And when we consider that the prefrontal cortex, that part of the brain that controls decision making and empathy and a number of other things, isn't fully developed in young people until around the age of 25, 15% of teens are still saying that it's something that they can't control. There's probably a much greater number of kids that just don't realize they can't control their drinking and they can't stop, and they've already formed a dependency on alcohol before they even reach adulthood. So here's the data, some of the data that's in the youth survey. I know you guys are looking at it and go, wow, it's a lot of numbers. And you may or may not be able to see it just depending on the size of your monitor or if you're watching it. If you're looking at this on a mobile device, definitely not going to be able to check it out. I'm not going to go into too much detail here on this screen, but I just want to show you kind of what it looks like in the Arizona Youth Survey. Breaks it down by grade level. So you can see 8th grade, 10th grade, 12th grade, and that's how the youth survey is conducted every 2 years. So that way, every 2 years, the youth survey is following a group of a certain age group of kids. So we have, I guess, more meaningful data that way, which is awesome. And just so you know, this is the Arizona Youth Survey is one of the larger youth surveys that's conducted that asks questions about drugs and alcohol. Anywhere from 40 to 50,000 kids are asked every 2 years. And if you know anything about statistics, you know that's a huge sample size. A lot of national statistics or the polls that we see on TV right now for the presidential candidates show national trends based on a fraction of that. So it's a great sample size, and we can get fairly meaningful data from this, which can help us make some better decisions. So something interesting, when you look at this over here on the youth survey, it says where youth obtained alcohol. And it has all the different questions. Alcohol has a ton of different locations listed on here because it is the most abused substance by teens. So that's why we really want to get down to where are kids getting it from. And the questions range from everything from I bought it at a store or a bar or a club, parents gave it to me, I took it from home, I took it from somebody else's home, I got it from a party, someone over the age of 21 gave it to me, someone under the age. So it really covers it from a ton of different angles. And when you look at it closer and you look at the average of all the grade levels, the bottom three places kids get alcohol relates to purchasing it. And that's because of sticker shock campaigns where kids go out and they put stickers on the alcohol at the store warning people that it is illegal to sell to someone under 21 or buy for someone who is under the age of 21, as well as all the policies and fines and things that are implemented for the different businesses that sell alcohol to make it to make them much less likely to want to sell to those people. So that really shows how important policy changes are in decreasing access to certain substances for young people. Here's pulling from that, and what I'll do is I'll send this out to everybody after the webinar. You'll get a recording of the webinar as well as links to where I got all this information so you can look at it in more depth. But something I want to point out from alcohol and where kids are getting it from, I don't know why it's showing up kind of weird here all of a sudden, but you see the home on the top, and that represents kids taking alcohol from home, not being given alcohol, but actually taken, so pretty much stealing. And then the bottom one, it's a little party, one of those little party popper type things, which is representative of parties. When you look at from 8th grade to 12th grade, the shift amongst these two, I think it's really interesting because a lot of times we think parents are, and why this is, the data doesn't tell us causation or why it is how it is, but we can infer certain things from the data. Looking at 8th grade, 25% of 8th graders get their alcohol from stealing it from home, taking it from home. Only 15% of 12th graders, which is, I thought was pretty shocking when I saw that because one, parents are probably a lot more aware in 12th grade. You're not thinking about it as much in 8th grade, thinking like, wow, maybe my kid's going to get into my liquor cabinet. But by the time they're in 12th grade, you're a lot more aware. So parents may be taking certain precautions at that grade level to keep their kids safe. Also looking at the availability, a 12th grader has greater availability of alcohol from a number of different sources. And that goes to show down on the second one with parties. 34% of 8th graders obtain their alcohol from parties, where 51% of 12th graders obtain their alcohol from parties. So you can see that kids have more options for where to get their alcohol as they get older. So that's why maybe they don't feel the need to take it from their parents, and also parents are probably doing a better job at keeping an eye on it at that grade level. So it goes to show that no matter the age, um, you know, parents and families should be aware of alcohol in the household, especially once kids hit middle school, and they're going to be more curious and they want to experiment and try different things. Be mindful of the substances that are in your home at all ages. Okay, here we have consumption, just so you can see from 8th grade to 12th grade how much it increases. But even at 8th grade, 32%. So just about a third of 8th graders have consumed alcohol. And this is what they're telling us. We're not just, this is 8th graders, 10th graders, 12th graders telling us that they've used these substances. So if you can imagine this is what they're telling us, imagine how many are not going to be as forthcoming about their substance use. So I wouldn't be surprised if these are a little bit higher, but this is what the data is telling us. By the time a young person graduates high school, two-thirds of them will have used alcohol here in Arizona. So let's take a look at medicine, which medicine is the fourth most abused substance here in Arizona among teens. That's over-the-counter medicine, prescription medicine. People a lot of times hear medicine abuse and they automatically think prescription painkillers, but it goes beyond prescription painkillers. Even things like NyQuil, sleeping pills, caffeine pills, a number of different medicines that you can get at the local CVS without even having a prescription are also being abused or can be abused by young people. So how the Arizona Youth Survey asks for the data, it's asking where youth obtain prescription drugs. It doesn't ask medicine in general, but this does give us a glimpse into where they're getting medications from. And when I say medications, I don't mean medicines that they're allowed to use and that they should be using, they're prescribed, that their parents give them because they're sick. I'm talking about kids abusing drugs for the purpose of getting high. And in 8th grade, that's about a little under 10% of 8th graders saying that they've used prescription drugs to get high. I think that's pretty high for any grade level, but already in 8th grade, 10% of 8th graders are saying they've already used a prescription drug to get high. By the time they're up to 10th grade, you're looking at 15%, and then just about 19% in 12th grade using prescription drugs to get high. And if you've seen on the news and in the media, all types of media lately, prescription drugs are have become what they're calling an epidemic. And we're also starting to see the connection between prescription drug abuse and heroin abuse, and how closely related those are, and how they're very closely tied together. I'll have a webinar here, I believe that's actually next month's webinar. So if you're interested in finding more about prescription drug abuse and the connection to heroin abuse among young people, I encourage you to check that out as well and register when I send out the link. So medicine, where are kids getting these from? Well, 25% took it from home. So a quarter of kids that are abusing prescription drugs are getting them home. And it doesn't necessarily mean that their parents are just giving it to them or they're careless leaving them out on the counter. A lot of times when people get a prescription for a painkiller or different types of conditions that they get different prescription drugs for, there's a ton of different types out there. They don't use them all. And so what happens? They sit in the medicine cabinet. And how long do they sit there? Until they either get taken or tossed out. So if you do have young people in the house, whether they're your kids or not your kids, it's important to be aware of what you have available right there in the medicine cabinet. It may not even be your kids, it could be friends, or it may not even be your house. Maybe it's your parents' house, so your kids' grandparents or an aunt or an uncle, and they don't have kids, or their kids are really young, so they don't think about it as much. They just think about getting them out of arm's reach from the little ones. But it's important that this is something you're talking about with not just people inside your household, but also with your the people that your kids may have access to those drugs from in their homes as well. And 59% got it from a friend. So if 25% are taking it from home, they're not always going to use it all for themselves. Sometimes kids are smart. There's a lot of entrepreneurs out there already in 8th grade, 10th grade, 12th grade, and learning that, hey, I can make money off this. And so they're selling. And maybe they're not even stealing it. Maybe it's their own medication that they're prescribed, maybe different ADHD or ADD medications that they're prescribed, but rather than using them, maybe they don't like how it feels, or they realize they don't need as much, so they have extras left over, or they just completely ignore using them altogether. Now they have a source of income. So that's something else to keep an eye on. Not just some kid, obviously not every home is going to have access to prescription medication. So kids are going to realize supply and demand. Kids are very smart, and we just need to be mindful of that. So moving on to marijuana. Marijuana is now the #2 most used drug by teens in Arizona. It overtook tobacco by the percentage of teens in Arizona who report abusing it, which I think is fairly alarming considering the number of locations that one can legally purchase tobacco. Obviously, you have to be 18 or over to purchase tobacco, but there's still a lot of other points of sale of tobacco than marijuana. So it's pretty alarming to see that marijuana is now the #2 drug of choice, where all other substances have been declining for a while at a steady rate. As far as teen use goes, marijuana around 2010 started plateauing. So everybody else, all the other substances have a steady decline, and then 2010 hits, while all the rest are going down, marijuana starts to plateau. 2010 was when Prop 203 was around, and this how it goes to show how perception of social approval is very important when it comes to youth substance abuse. Well, even though it wasn't legal yet, even for what Prop 203 proposed for medicinal purposes, it was changing perception already, and young people perceived it to be less risky and more socially accepted because people were just joking about it, making it seem like it's no big deal. When in the reality, we know that marijuana abuse is a big deal. And I'll get to that here in just a second. In 2012, 11% of high school seniors reported getting marijuana from someone with a marijuana card. In 2014, that was up to 18% of high school seniors who use pot, reporting that they got it from someone with a medical marijuana card. So it goes to show that when you increase access to a certain substance, kids are going to get their hands on it more. So, which leads me to why is this really important? Because a lot of people, more here, and this just goes to show friends by far is the #1 source where kids are getting it from. But when we consider that a lot of their friends may be getting it from people who have a medical marijuana card, we can see how that really makes it something more alarming for us to consider as we approach future moves to make marijuana more accessible, and 14% getting it from families. We know marijuana is addictive. 90% of addictions begin before adulthood. So the more we see kids using marijuana, the more we're going to see dependency from marijuana, because 1 in 11 marijuana users become addicted. Of daily users, that goes up to 25 to 50%. So definitely something to keep in mind. So what do we do? What can we do, right? Act as a filter. And here I put a water filter that you can see. And the reason I put a water filter is because water filters, a good water filter is going to filter out harmful things and make sure certain minerals are included in our water in different ways. And that's how we need to approach filtering out some of these influences. We can't just completely ban our kids from every type of social media site, because there are things that are beneficial in social media, in the news, in music, things that are culturally relevant. So we can't just shut them off from the world. By becoming more aware of what's out there and having conversations with our kids, we can kind of filter what those perceptions are for our kids relating to drugs and alcohol. So recognizing we can't just completely get rid of it, but some things we need to just have a conversation about. And some things maybe we need to encourage the type of behavior that we do like by promoting friendships that we know are positive for our kids and are going to result in our kids becoming the types of people we want them to become. Doesn't mean we just cut off all the friends we don't like, but also encouraging the friendships and providing more opportunities for those friendships that we know are going to be beneficial to them. We can also help build resilience. That's through those conversations, having a plan for our kids if they are confronted with the opportunity to use drugs or alcohol. Hearing what they listening to your young people is very important. And clearly communicating expectations. We can't assume that young people know what our expectations are. We need to communicate those, whether that's verbally, some people that's with a written family contract. It's going to look different in every family, but they need to know what the expectations are and what the consequences are. What we can do is a really big topic, and that's something that we cover in much more depth during our parenting workshops, active parenting and active parenting of teens. We have a ton of those that are getting ready to get started here in the upcoming weeks and months. I encourage you, if you want more information for yourself or parents or caregivers of any age that could benefit from that, check out our website and the workshops that we have scheduled, because we go into this in much more depth. It's a 6-week-long course that really allows us to dive into that topic. You can also go to our website for more information. We have tips on talking with your kids about drugs and alcohol, conversation starters, how to address things like, well, you used it when you were younger. Those are really tough questions to answer a lot of times. So we give you some tips and tricks for how to approach those conversations, and what that may look like in your family is going to vary, but we just give you a couple different ways to approach it that can help you start those conversations or help you filter out some of those negative influences as well. That is all I have for you guys today. I know I went about 5 minutes over. I appreciate you guys sticking in there. I am going to put up a survey really quick, and then I'll put up my contact info. If you could take the survey, I think it's about 3 questions. Just take that survey. Whether it helps us with our funders, letting them know what people are taking away from the program, what we need to work on. It helps us out as well in the future and making sure we can continue these programs. We are funded by the the Parents Commission on Drug Awareness. I know I'm flubbing that all up. They recently changed their name, so we have the Governor's Office of Youth, Faith, and Family, and the Arizona Parents Commission on Drug Education and Prevention. That's a mouthful. Said it a million times, but it never gets easy. So we do appreciate our funders allowing us to deliver this information all across the state of Arizona and beyond. I know there's people from other states that join our webinars all the time. Now I want to open it up to questions. If you have any questions, put those in the chat box. I'm curious to see maybe what I didn't answer or anything that we just didn't get into, just for time's sake. And if we have no questions, that's cool too. People I know a lot of times come back afterwards. An hour later, people go, oh shoot, I forgot to ask you. That's totally okay. Send me an email. Here in a second, I will, once I end voting, end the polling for that survey, you'll see my information. A lot of you probably already have my information. It's justin.mcbride@DrugFreeAZKids.org. That will give you, you can email me anytime with questions about this or other things. I'm going to go ahead and end the survey here in about 5 seconds. So go ahead and submit that if you haven't done so already. And I see we do have some questions. Will you give us the reports for printing out? Yes, I will. This here, and what's great about the Arizona Youth Survey, I'll send you links to all this information. Here I have it printed out by the entire state data, as well as Maricopa County and then all the other counties, because we work with different counties throughout the state. I'll send you a link of where you can access statewide data, as well as how to pull different information for your county specifically, or specific substances within your county. Their website breaks it down fantastic in a fantastic way that people can use in a million different ways. I know I use it probably every month in a new way. So yes, I will be sending that out as well. Are there any other resources out there to whether or not kids are getting marijuana from card holders? That's as far as I know, as far as like official surveys go, that's going to be the biggest one that I know of. Um, I'm not aware of any. If you guys are aware, feel free to share that. But I don't. There's none that I know of on the statewide level. There may be some local ones. But for the most part, I know that's where we get that information from. And also you might, if you're curious more information about kids getting marijuana from card holders, you can check out other states' data where relating to their medical marijuana laws and if more and how kids are obtaining it through that. Because even though it's a different state, a lot of times we can learn a great deal from looking at what other states have already gone through without always having to wait 10 years down the road to see what's going to happen here. We can learn from a lot of other states. I know that's what the folks in Colorado are saying, the law enforcement folks there. They're saying, before you make a decision, just wait and see what happens here. Unfortunately for them, they're kind of a guinea pig for a lot of those things. Is there a phone number? Oh, I need to put up my information here. Sorry about that. All right. Here is my information. It says, is there a phone number to call if an individual knows of other cardholders calling, selling their marijuana to individuals? Yeah, I would say you could call your local police department. You can call, every police department has non-emergency numbers. You can call those. You probably could call 911, but I know it's not really always considered an emergency situation. I mean, unless you see somebody propped up on the street corner, selling marijuana out of the back of their car, maybe. But if you do know of it, I encourage you, contact your local law enforcement. I bet, and they'll probably be able to give you the best guidance on what to do. All right. Um, and we see call that organization. Yeah, I don't have those offhand, but when I send out the all of the resources and the recording of the webinar, I'll make sure to include a list of what I have is for some local agencies that you might be able to contact in the different counties. I can definitely add that. I don't have those off the top of my head, but I will include that for you guys as well. Ooh, let's see. And there was a question about other street drugs, where kids are getting other street drugs. Okay. Sorry, some of them were scrolling through, so if I missed the question, feel free to plug that in there. Yeah, where are kids getting other street drugs? The Arizona Youth Survey doesn't ask where kids get every single substance, just because it asks out a ton of different substances, and the survey would be probably take kids a month to complete if it did. But just from the data that we can see from things like marijuana, prescription medication, alcohol, that gives us a lot of guidance on where kids are getting their substances from. Because the number one source of drugs of any type for kids is going to be friends. It's going to be people close to them. They're not friends and family. It's not going to be kids out there buying it from a drug dealer in the alley necessarily, unless that drug dealer in the alley happens to be a friend. Yes, there are people that are going to do that. A lot of times it's through referrals. How do you find out about your doctor or your massage therapist or whoever it may be? Kids are very resourceful and they do the same thing. Kids have a huge social network, and that's why getting their hands on drugs of any kind can be easier for young people, especially those that are a little more social, because their network is so vast. And sometimes it's just asking like, hey, do you know anybody? And maybe their friend doesn't, but a friend knows someone who knows someone, type of a deal. But as far as other street drugs, I will include all the resources that I have for asking specific questions on those surveys, what youth are telling us, and what the different law enforcement agencies say. I will send you guys out all that information that I have, because there's a ton of it out there. Do we have any other questions? All right, well, I don't see any questions. So if you guys have questions, feel free to shoot me an email, justin.mcbride@drugfreeazkids.org. You can also call me here at our office, 602-264-5700. I'm at extension 11, and I'd be happy to answer any of your questions. Thank you guys so much for joining us today. I know a lot of us are really busy and swamped, and your lunchtime is the only time you have free. For those of you that have, I do ask if you had anybody that joined you during the webinar that's sitting with you around one computer that you're logged into. If you guys could just do me a simple favor and in the chat box put +1 or +2 or how many extra people are with you, just to give me an idea of how many people we have additional to just the login. That'll help me out a lot. Join us next month for RX to H, which is prescription drugs to heroin. We'll show what the link is between prescription medications and heroin, as well as what we can do to help prevent our kids from abusing prescription drugs and heroin. Alrighty. With that, I thank you guys again for joining me. I'm going to be logging off now. I look forward to seeing all of you next month for our webinar and look forward to hearing from you with all your questions, no matter what they may be relating to drugs, alcohol, and keeping young people safe. You guys have a great day. Bye-bye.